Hello, Namaskar, and a very good afternoon to all the viewers watching our session out there. This is Simran Singh, and you are watching this particular live telecast on eVidya channel number 1 to 12. Besides, we have so many different mediums through which you all can connect with us. You can participate in our live interactive sessions by commenting in the comment section of our YouTube channel that you all are well versed with. It is NCRT Official. So it's around 12 noon at your watch, and regularly from 12 till 12:30 p.m. we have our very special sessions for all our viewers. That has gone by the name Teaching Learning Interventions for Inclusive Classroom, where we try to raise awareness about inclusive classroom setup. And today is a very special segment of this series, and I would like to inform you that the title of discussion is The Audiological Clinic. Now, what is the meaning of this term? How do we identify what is it, and how can we understand it? So, providing us more insights and shedding more light in the conversation we have with us are two guests as well. So, allow me to introduce with you our first guest, Mr. Salaj Bhatnagar sir. Namaskar sir, good morning.
Well, very good morning.
Welcome to the conversation.
Thank
Sir is a director at Noble Hearing and Speech Therapy Clinic, and he has connected with us through Indore. Then just besides me, the screen is being shared by our sign language interpreter, Mr. Nirbhay Kumar Mal. Namaskar. We welcome you as well. And Nirbhay ji will be interpreting this entire session for all of you so you can understand it better. And in case if you have any queries, you would like to ask us anything in this live interactive session, then feel free to comment in the comment section or either contact us through this contact number that is flashing on your screens. So you can give us a call at 8800440559. Besides, some specific mail IDs are also flashing on your screens, and one of them is dth.class12@ciet.nic.in. So let's begin this conversation. So Salat sir, in the first place, I'll request you to apprise our viewers more about what is meant by audiological clinic. How do we define it? What is it all about?
Basically, audiology is the science of hearing, and people who study the science of hearing is audiology. In our country, we have a course which is 4 plus 2 plus 2, and you become a qualified audiologist who is specialized to take care of the hearing health of people. And a clinic of such nature is called an audiological clinic.
Thank you for discussing it with all our viewers, what is meant by the title that we have for today's conversation. So sir, as we are discussing on the broader aspects associated with audiological clinic, I have another question. Sir, how much does hearing loss affect a human life? Let us all try to understand it.
ఏం చెప్పినారు నాకు అర్థం కావట్లేదు ఏంటన్నారు మీరు you are zapped, right? You are absolutely zapped because मैंने बोला आपने सुना मगर आपने उसको समझा नहीं.
जी.
So that is the importance of hearing in your life. Basically, hearing will have its own effect depending upon the age on which the loss has started. If the hearing loss is right from the congenital or maybe at the birth, the child will never be able to hear. If you don't hear, you don't speak. You don't speak because your language is not into your brain and you are not able to speak and hear simultaneously. So unfortunately, many a times it is seen that kids are not being identified till the age of 3, 4, 4.5, 5 because everybody feels that theek hai, bolega bachcha. That is what the common people understand. Sometimes people or kids speak late, but that is not true. So it is very important that if the child is born with any other problems associated, hearing evaluation should be done. And when it comes to scholastic, if the hearing loss is occurring at the age of 5 to 10 or 15, his education is separate. If it goes into the teens, his college is separate. When it comes to marriages, there are many marriages which are broken just because of hearing loss. You lose your job. When it comes to old age, you are alone because hearing loss makes you cut from the society, from the Your own family also gets detached. You get into depression, you get into loneliness, anxiety. So hearing loss is a very unspoken, untold sabotager which slowly eats away the personality, the growth, and your connectivity with the world. So at every age, every part of your life, hearing loss to a certain extent is manageable, but yes, when it crosses a certain limit, it starts eating your life.
Of course, sir. So, with regard to that, sir, how early can we identify the hearing loss in any child? Like, can we identify right in the beginning or the initial years of his or her life, maybe since childhood?
Yes, now see, technology has gone far. You can have a hearing screening done right on the first day the baby is born. So this is the important thing where we in our country need to really emphasize to the government and the hospital and the medical people that when we can have an eye checkup for a baby born in the NICU or a PSU, hearing health should also be monitored. If a baby is identified to be having query hearing loss, because that is going to be a screener, we can have a follow-up with those babies and get a diagnosis by the time the baby is only just 3 months. And if this kind of early identification is being catered down to the public, I think the rehabilitation is going to be very fast. The nature of rehabilitation is going to be very good quality, and the child doesn't lose the crucial years, the critical period where the language is being learned is restricted. So early identification, we test very simple tests like OE, which is non-invasive. It just takes 7 to 8 minutes to do the test. That doesn't require any huge instrumentation. It can be carried to the bedside, to PICU, NICU, and we can get these results. So I take this an opportunity to really insist upon the early identification of children because 2.5% children born do have some or the other hearing defects, which can be identified as early as first day the baby is born. And we can have the management plan by the end of 3 months the baby is and take a right path towards the true rehabilitation and true integration.
So, sir, in case if the doctors or I should say the caretakers or parents have identified early, or maybe as you mentioned, since the first day the baby is born, that he or she is suffering from hearing loss. So, sir, what are the available options that are already easily accessible for the treatment of hearing loss?
Right. So there can be two kinds of problems with the children. One has something to do with corrective measures, where the surgical aspects, like if the baby is born with no canal or no pinna, so or some fluid in the ear, those are the factors which can be rectified through small surgeries and medication. But when it comes to sensory neural hearing loss, which is kind of a permanent hearing loss, where the hair cells in the ear are not functioning, then you need to go for a rehabilitative or a corrective measures like hearing aid fitting and cochlear implants, which is the latest technology available in the country. The earlier they get the hearing devices, the better the stimulation, and they don't lose upon the critical period, which is supposed to be 0 to 2 years, where the brain synapses are developing for language and understanding through audition. So we are keeping the gateway of knowledge to the child to develop his language. Only then the child will be able to speak. Without language, you will be zapped like what I started speaking in some other language. So in spite, if you are hearing and you're not understanding, then you are as good as deaf. So early identification, early rehabilitation would pave a good way for a child to develop normal language and normal speech because he has normal language development and open the doors for him to fight with the normal population in the society.
So, sir, I do believe as of now people are aware of hearing aids. At least we have heard this term, hearing aids. So you have also mentioned about cochlear implant. What is it all about, and is it the same as hearing aids, or does it encompass something different?
Definitely, it's a huge technological leap in deafness correction. Uh, Cochlear implant is a technology which is around, I would say now 40-45 years old and around 30 years in our country. Hearing aid is a technology where the technology uses the residual hearing of a child. जो बची हुई क्षमता है उसका उपयोग करती है. And it is kind of an amplifier, but now you have digital hearing aids where the quality is good. So hearing aid is technology which has got its own limitations. It doesn't rectify 100%, but it uses the residual hearing of a baby. If the baby is 80%, having 80% hearing loss, so the 20% is the residual, and that 20% is being used by the hearing aid to send the sound to the sound energy to the brain. Whereas cochlear implant is a technology which bypasses the entire system of hearing, and it induces a system where 100% sound is being given to the cochlea for further transmission. So naturally, when a pipeline is being repaired from the place it is being leaked, there are chances that the entire energy might have got lost, versus the entire pipeline is replaced will give better results. So cochlear implant is the best technology to correct hearing losses in present scenario.
So, sir, as you have just said that it is the best technology as of now that we can use for hearing loss. So, sir, if you could tell us more about its success rate.
Basically, the success rate would definitely depend upon the nature of the hearing loss, the kind of hearing loss, anatomical structure of the baby with hearing loss, and moreover, very critically, the age of the child. The earlier the surgery, the good the anatomical structures, the success rate is 99.9%. And this can be improved. Surgical output, surgical results are 99.9%, but the very important aspect related to this is therapy. Because the baby is hearing through an electronic device, the system, the human brain, the human chemistry has been tuned for some different biochemical reactions. But cochlea develops a different kind of chemical reactions. It could be more metallic. So the baby would require associated training, which is called auditory verbal training, where you are retraining your brain to hear through a system which is sounding a little different. So the success rate is surgery, the implant used, and the quality of auditory verbal therapy given to the child. Usually it requires 2 years of therapy, plus or minus, never minus, but definitely plus 1 more year. Now the question would be, why 2 years? Agar implant lag gaya, the baby should start speaking.
Yeah.
So that's a very good question, and most of the parents fail to understand that a normal baby also when born doesn't say mama bhook lagi doodh pila. The normal baby also takes 1.5 to 2 years to come to a sentence level. So God has made such a key in our system where the babies have to hear the world at least for 1.5 years to develop their vocabulary. The brain gets synapsed at different angles. Different synapses are developed for the language. The biochemistry is developed in the brain, and that is how the baby gets kind of a base for speaking. So 1.5 year is all listening. 6 months is all practicing ta ta ta, ba ba ba, ma ma ma, cha cha cha. You can understand how the child slowly goes towards words, phrases, misarticulations are there, pronunciation की गड़बड़ी होती है, धीरे धीरे you see by the time the baby is 2.5, you are able to understand the baby in complete sentences. So post-operative cochlear implant also, there is a need for us, the speech therapist and the parents, make it very sure that you are going to the right hands and taking auditory verbal therapy after cochlear implant surgery also.
So, sir, discussing at length about cochlear implant surgeries, Are there any standard protocols? If yes, please highlight them for us along with the rehabilitation procedures that are associated with it.
Yes, ma'am, definitely. Surgical protocols are very well laid, and post-operative therapeutic intervention programs also are very well laid down. There are criteria where the baby selected for a cochlear implant has to undergo certain medical uh, testings and audiological testings. So first of all, we need to identify a baby, whether the baby has sensory neural hearing loss that is non-repairable, number one. Number two, the hearing loss is so bad that the chances of language learning or auditory perception is very limited for the child. For instance, if a baby has a moderate loss, he can be or she can be helped with a good quality hearing aid. But if the baby has hearing loss more than 75%, that is severe and above, then it is unlikely that baby might be able to totally get the language or a speech. So they are the right kids where we need to identify and take them for detailed evaluation as far as audiology is concerned. We need to go for a radiological evaluations where CTMRI is being done, and we need to make sure the cochlear structures are intact, because where that is the place where a ENT surgeon is going to insert the implant. And after that, the other thing is intactness of the nerve, which is going to the brain, which is the carrier of sound signals to the brain, is also intact. Once all these things are done, then we need to take care of the general health of the baby. We need to get an approval from the pediatrician regarding the other aspects of the baby as far as general health is concerned. Then the baby has to pass the test of anesthesia, whether the baby is able to take anesthesia. And if everything goes good, the baby should be installed for surgery as early as 1.5 years of his age or her age to get the best result of it. Post-operatively, what auditory training program and switch on. Switch on is a procedure where we have two parts of cochlear implant. One goes into the skin and the head, and the other is sitting outside the ear. So that is taking sounds from the environment and giving it to the internal processor, internal chip, and that is being transmitted to the brain through the nerve. So after the surgery, once the healing is good of the baby, we put the external device, which is called as switch on. That is the day the baby is born for hearing, not listening. The baby will start hearing sounds around people talking, but not able to listen. Listen and hearing is basically, you know that there is sound, but you don't know what sound means. So that meaning has to be put into the baby through auditory verbal therapy. So this is the procedure. It sounds very simple, but it is very long. It takes around 2.5 years of the baby's input from the parents and the therapist and the audiologist, because he keeps tuning the stimulation to the baby every month. And if everything goes good, we have cochlear implanted children who have done their civil engineering, who have done their uh, graduations. So success is definitely there if the protocol and the procedure is done rigorously.
So, sir, as we are continuously emphasizing on inclusive classroom setup, so when I talk about child integration with cochlear implant into the, I should say, the normal stream with everyone else in the society, what are the changes, how it can be worked upon, and also shedding more light on the challenges that one goes through?
Yeah, this is again a very untouched part, madam. Unfortunately, the understanding of hearing itself is so low in our country. Yeah, you come across many movies, many serials where hearing loss is taken as a part of a joke or a part of something where the patient is the person is being laughed upon. But hearing loss is such a serious issue, and it sabotages the entire life of a child, whether it is child, whether it is senior citizen. So cochlear implant, the technology is developing. Definitely hearing aids have also come to a very good level. Implant has really turned the tables. But the need of our is acceptance and understanding of general public about this hearing loss, about the hearing aid, about the cochlear implant, and their acceptance for these children who have been operated upon are on the path of the success route. But still, the society has a lot of reservations for these children. Maybe cochlear implant, may it be the hearing aid. People don't mind having specs, but people do have a lot of reservations when they see people having hearing aids or a cochlear. Technically, if you see cochlear implant with all possible correct measures taken, the success rate of that technology should have been 99.9%. But very sadly, if we come across and we study, the success is only 30%. Why is that? There are huge gap between actual success and the technology which has got the competency to give 100%. So we try to understand this. We went into a lot of studies, lot of research. So where we are failing is failing about the auditory verbal therapy approach. Lot of people feel when I am spending 6 lakhs, 8 lakhs, 10 lakhs, 15 lakhs, 20 lakhs, why there is a need to go for therapy. My machine is good enough. I have done the best for my child, and my child should speak. So it is important for us, for the parents to make understand, boss, you have got the technology, you've got the best computer, but you need to have the language to run that computer. Secondly, there are many incidences with due respect to the medical fraternity. Still, the insight and the success has not been educated or not been demonstrated to the medical fraternities, because most of the pediatricians and ENTs, they say that, ठीक है, हो गया ना, अभी तो अपने आप कर ले. So we need to work on that. Thirdly, ma'am, the very sad part is when you start giving therapy to the child post-operatively, the initial phase is tough, but by the time the child is 2 years in AVT, he'll start speaking in sentences, and mother is happy, father is happy, the entire family is happy. हाँ ये बोलने लगा, अब तो story बोलने लगा. Now he's talking on phone also. He does dance also. Rhyme भी बोल लेता है. The entire family is so obliged and so happy, but the real happiness goes down because when they take the child to a school, in a normal school, for an admission, first of all, the principal has a query, भाई ये machine हम नहीं दे, मुझे नहीं लगता हम कर. Then many a times we need to go and intervene and explain the principals or teachers, this is nothing, it is as good as specs. So please, you give a chance to this child. This child should do as good as any other child.
Of course,
मिल जाता है बच्चों को,
yeah.
बच्चों को permission मिलता है, they get the admission, but again, that doesn't end there, ma'am.
Yeah.
Unfortunately, what happens is after that, when the child is being sent to the school, he goes to the school, he's hearing, but gradually his performance starts falling down. Now, the reason for this, the child for his 3 years of life has been taught auditory verbally, never given any scholastic inputs, never had a peer pressure as what happens in the class, because AVT therapy or a speech therapy is one-to-one therapeutic program. It doesn't allow you to have more than one child in the room with the teacher. But whereas when it comes to school, the child suddenly gets a shock of his life because he has to compete with other kids who may be at par with that child. Thirdly, the teacher is totally zapped or confused. How do I handle this child? And I would not blame the education system, because in a class they will have to handle another 20 kids. He or she cannot just sit with this implanted child. That is the biggest challenge. And if you go to the research papers, you will realize there are at least 55% dropouts of cochlear implanted children from normal schooling, and they are being deprived, not because their fault, not because the fault of the education, not because the teacher is insufficiently doing, not because the principal has not allowed. It is just because the integration system is very, very poor and very, very poorly knitted. So I would think there now that the time has come for us, because every year there are more than 2,000 kids being operated under some or the other government schemes, and equal number are being operated in private. So mota around 4,000 to 5,000. It would be much more, I believe. Kids are being operated upon with only 25-30% of success as far as true integration is concerned, just because our two systems are not having a gelling technology, a thing where there is a bridge. So I have got a dream where I would love to start a concept called Setu. Setu is a bridge where it takes the child, the implantee child, step by step, to this hearing and speech world with normal children sitting with them. The first 2 years, the child is independently studying, reading, everything, but now he has to learn the grammar, the syntax, syntactic abilities, which has not been given to the child till the age of 2.5, 3. So why can't we have Setu schools for cochlear implant children, where half day the child is being taken care by therapist and half day the child is being taken by the Montessori trained teacher, where the scholastic inputs are given to these children. At the end of 4 years, the child should be able to attain any normal school and develop his scholastic achievements along with his speech and language.
Of course, sir.
So if this can be initiated in our country, the success is going to be too high. We will be able to integrate these people and make a good contributor to the society. You are going to help hundreds and thousands of families who have been suffering because of the hearing loss. They have been really have a sad life because they see their children going into their own world of sign language, where it is really sometimes very difficult for few parents to accept. Technology is there, professionals are there. It's the only time has come where you really need to think out of the box, get a system intact, get Setus, get Setu for cochlear implants, and they will do best in their life.
Sure, sir. Thank you so much, sir, for sharing this, I should say, exclusive or less talked upon areas for all our viewers. And you have appropriately mentioned, for example, I am a spectacle person, so I regularly go to my eye doctor for the checkup of my eyes. But when it comes to our hearing health, we often fail somewhere. So thank you so much, sir, for bringing this topic to the platform and highlighting these important areas for all our students. Even if when we talk about an inclusive classroom setup, we must be aware of these minute yet necessary details. So thanks a lot.
Thank you very much.
Thank you to all the viewers who have connected with us for this particular conversation. Here I have a very special information for all of you. As you know that from 3rd January 2023 till 7th of January 2023, the Department of School Education and Literacy, Ministry of Education, Government of India has organized Kala Utsav to promote arts in education and also to showcase the artistic talents of students. So let's watch a few glimpses of Kala Utsav.
India is our land of diverse culture and glory. Let's showcase the art with the glimpses of its story.
We hear the sound of music, we dance to angry bells. Paint a picture, make some toys rejoice.
Let's do solo acting, let's dance, let's sing and paint.
Some toys rejoice. Kala Utsav, Kala Utsav, Kala Utsav, Kala Utsav.
Children from every nook and corner will perform.
Oh, great!
We We will have glimpses from each and every state.
We hear the sound of music, we dance to and clip bells. Paint a picture, make some toys rejoice. We hear the sound of music, we dance to and clip bells. Paint a picture, make some toys rejoice. Kala Utsav, Kala Utsav, Kala Utsav, Kala Utsav.
Kala Utsav, an initiative of the Department of School Education and Literacy, Ministry of Education, Government of India, announces Kala Utsav, organized by NCERT from 3rd to 7th January 2023 at Regional Institute of Education, Bhubaneswar. Kala Utsav.
The live telecast of Kala Utsav is brought to you by Regional Institute of Education, Odisha, Bhubaneswar, NCERT. So we are eagerly looking forward to your active participation in this initiative, and do watch it and encourage our students. Once again, I would like to take the moment to thank our two experts and the guest of the conversation. Thank you so much, Salad sir, and thanks a lot to Nirbhay sir for interpreting this entire session so beautifully for all our viewers. And I am pretty clear that the meaning of the audiological clinic and the different aspects associated with it are equally highlighted and cleared for all of you. So all the viewers watching this session, now it's time to wrap up this particular live interactive session. But stay connected and stay tuned with eVidya channels. We'll be right back at 2 p.m. with another session. Namaskar.